My name is Colin Campbell. I am one of the consultant epidemiologists at Public Health England in the immunisation team on COVID vaccine coverage. But this is not about me. This is about all our speakers this morning. So just a little bit of housekeeping first. So there's obviously no fire drill today. What we have is a session that will end at 11:45. I think speakers should have about 5 minutes to speak. And since we have the timing suggests that perhaps we can have the questions at the end, where we have further discussions. There is a hashtag for the conference, PHRSC 2021. So please do use it if you want to tweet anything out. So the chat will be open throughout the session and ask questions, and I'll pick up on those afterwards. I'll just turn on my video while speaking so you can see me. When during the Q&A session, please use your raise hand function to ask a question. When asked to come forward, come off mute and ask away. So what we have this morning is 4 titles. We have Kirsty McClanders giving us an understanding of attitudes, behaviours and enablers, followed by Sandra Munier-Jack on the influence of organisational factors in COVID-19 vaccination in health and social care workers. Whitney Curry on drive-through vaccination programme for rural county in the UK, an evaluation. And lastly, Kennedy Obohwemu on parental childhood vaccine hesitancy and predicting uptake of novel coronavirus vaccination. And what we'll do now is move on to our last presentation, and that's Kennedy Obohwemu on parental childhood vaccine hesitancy and predicting uptake of novel coronavirus vaccination in the UK. All yours.
Yeah, thank you very much. Hello, everyone. It's a privilege for me to be in your midst. I'll be presenting my research, which is ongoing, using the following outline. Now, throughout history, vaccines have played an important role. Next slide, please. Throughout history, vaccines have played an important role in the prevention and control of communicable diseases. Despite the well-documented importance of vaccines, millions of children across the world do not get the recommended doses. This poor vaccine coverage has led to a resurgence of vaccine-preventable diseases in the UK and other parts of the world. The WHO recommends at least 95% vaccine coverage to prevent outbreaks and ensure the health of populations. In the UK, the levels are falling below consistent standards over the last decades. Next slide, please. Vaccine-preventable diseases are responsible for more than 1.5 million infant deaths around the world. So what are the issues? Next slide, please. What are the issues? Is it a problem of access to healthcare facilities or the fear of vaccine side effects, such as the recent link between COVID-19 vaccine and the development of blood clots in the brain? As a parent, are you ready and willing to present your child to get the COVID-19 vaccine? By definition, vaccine hesitancy is defined as the delay in acceptance or refusal of vaccines despite availability of vaccination services. So if you have been invited to get the COVID-19 vaccine and you have not, for reasons other than you being ill or allergic to a component of the vaccine, then you are quite simply vaccine hesitant. This is such an important public health problem that it was listed by the WHO as one of the top 10 threats to global health in 2019. Across the globe, this is the prevalence of vaccine hesitancy across the globe, especially in Europe. No such data is available for the UK and other parts of Northwestern Europe, hence the importance of this research. So this research will aim to determine the prevalence of childhood vaccine hesitancy among parents and predict the intention of these parents to adopt protective measures. So what will be the methodology? The research has 3 components. The first is a systematic literature review. The protocol for this has been drafted and is available on Prospero. The second study is the general vaccine hesitancy study, which will be carried out using the widely validated survey instrument, Parent Attitudes About Childhood Vaccines. I've gotten in touch with the developer of this survey tool, Opel Douglas of the University of Washington School of Medicine. He has forwarded the survey, scoring instructions, and relevant citations. For the third component of the study, which is COVID-19 hesitancy study, we'll use the construct of the protection motivation theory. Next slide, please. For lack of time, I won't be able to go into details of this theoretical model, but these are essentially the constructs we will use to try and predict the intention of parents to adopt protective measures. So for studies, next slide, please. So for studies 2 and 3, we will conduct a cross-sectional study in an online community of parents aged 0 to 6 years living in the UK. Purposive sampling will be used for the data collection. There will be a web page which we'll use to recruit about 350 participants. There will be extensive social media advertising to Facebook and other social media channels. We'll also target specific online groups like MomsNet to supplement the data collection process. We expect from this research to determine the prevalence of parental childhood vaccine hesitancy. We'll identify the barriers of parental childhood vaccine hesitancy and cluster them according to a conceptual framework based on the protection motivation theory. The findings of the research will be analyzed and the barriers will be discussed using the 5C psychological antecedents of vaccination. Next slide, please. So in conclusion, the research will measure the prevalence of parental childhood vaccine hesitancy in the UK and predict the intention of parents to present their children for COVID-19 vaccines. The study will provide a basis for recommendations for interventions, and it will also provide a valuable backdrop of evidence on which decisions about policies and practices can draw. Next slide. Thank you so much for listening.
Okay, thank you very much, Kennedy. Okay, so we now have plenty of time for questions. So I suggest that you either raise your hands or post them in the chat, and that you direct them at the presenter you wish to answer the question. Any questions, please, or issues to bring up? So, Kennedy, from the literature that you will have done in the past, what insights are you particularly feel you'll gain from, sort of from parental attitudes that might be applicable to, say, COVID?
All right, yeah, thanks. Well, the literature review, it's ongoing. I've been able to look at the database, pinpoint which search engines to use, and about 28 studies have been identified. The surprising fact is that there is sufficient quantitative research that has been done in this area, especially in the UK. The focus has always been on other demographics. Many researchers have not looked at the perspectives of parents of children within this vulnerable age group, because studies have shown that children less than 7 years old are the most vulnerable to vaccine preventable diseases. It's well documented in the literature. So it has come as a surprise that there is lack of studies, lack of quantitative data in the UK regarding the perspectives of parents on an issue as important as vaccine hesitancy. There is so much qualitative data out there. There is so much research that is not cross-sectional in nature, trying to get the perspectives of parents about general vaccine hesitancy and COVID-19 hesitancy in particular. So this shows the importance of the current research, because if such data is not available in the UK and other parts of Northwestern Europe, it means there is plenty gap in knowledge which researchers should try and fill. It's part of the reason why we decided to take up this particular research. So there is still plenty room. It's a national survey, but it will be good going forward if researchers could come forward and get the perspectives of parents across the different regions of the UK. Could be England, Scotland, Northern Ireland, Wales, or a particular region of England. There is a lot of quantitative studies that still need to be done going forward. So this is a step in the right direction, and we hope that the findings, when the research is concluded, will be an eye-opener to other researchers, those in position of authority, policymakers, especially within the social context of COVID-19.
Okay, thanks, Kennedy. Kirsty, do you have a question for him?
Thanks, Colin. Thanks, Kennedy. Just to say that I would be really, really interested in your findings of the work. So obviously, are you doing the work based in the Northeast, Kennedy?
No, it's a national survey. It's not. We're not getting perspectives of parents in the Northeast. We're looking at the entire UK population.
Yeah.
So,
yeah.
Yes.
No, that's good. I just wanted to clarify that, and so it'll be really, really interesting to see the output of that work, and more. I'd be really happy to link up with you after this meeting just to see, to keep in touch and see what your findings are, because that's something we lead on and work with NHS England, who are the commissioners of those of childhood vaccination services. So we would be really, really interested. We're actually doing some insight work currently now with parents and carers of 2 and 3 year olds for the flu vaccination, so it might be something that we could link in together with. Yes, that would be lovely. I'd be happy to work with you. Thanks, Kennedy.
Okay, comment in the chat. Yeah, from Navpreet, interesting to understand parents' perspectives of a COVID-19 vaccine, but also, of course, for any new vaccines that may occur in the future. So yes, a good point there. Thank you.
Yes.
I just one question for you, Kennedy. You mentioned that the way you'll be advertising, socializing the research and opening it to people, to participants, Mumsnet, etc. I guess my concern the question is about representativeness of attitudes, because sort of certain perhaps groups may be more vocal on certain platforms than others, and how you will ensure that you've got a sort of nationally representative population.
Yes, because we are getting the perspectives of parents, we need to work with a specific target group. So and it has to be parents of children less than 7 years old. So it's not, if you are a parent and you have a 21-year-old child, for example, you will not be eligible to participate in this study, because we're looking at childhood vaccinations, not teenage or adult vaccinations. So, well, because face-to-face data collection methods are virtually impossible due to, so it has to be an online study. So that's why we adopted the purposive sampling technique. Yes, there is worry about the representativeness of the sample, because we want to know, will it be representative of the entire UK population, since we are forced in a way to go online and target specific online groups. But well, that is a worry, and that makes the research prone to some bias, as it were. But it is the methodology, it is the approach. There is no other sampling strategy that would be more befitting considering these current circumstances. So what we try to do is, instead of just limiting it to those specific online groups, the advertising on Facebook and other social media platforms will make it more open to parents who may not be within those specific online groups. So if it will be a general ad on Facebook, on Twitter, on Instagram, other social media platform, to supplement the data collection process and make sure that our sample is more representative of the UK population.
Lovely, thank you. All right, well then I want to come back to Kennedy. Very interesting comment in the chat, so it would be really nice to hear from you directly on that, on care home staff.
Yes, it's an interesting discourse. Can you hear me?
Yes.
Yeah, well, at least I can speak from personal experience. I work in a care home, so that, unfortunately, that has been the approach. People feel threatened. People feel people feel like they are obliged to take necessary steps. People should not be made to feel that I can't think straight, I can't make my own decisions. You have to take decisions for me because I am a staff of this establishment. So by relating people's ability to adopt a given protective measure to the risk of losing their jobs, it could make people go mental. And I personally have had interactions with staff who have said no matter what is done, they will not take this COVID-19 vaccine. For example, it was the same experience with the MMR vaccine, the flu vaccine, other vaccines that have been rolled out over the years. So I think a lot of orientation, people should be more oriented, especially the managers in charge of these establishments. It should always be consultation. What exactly are the perspectives of staff towards not only COVID-19 vaccines in particular, but general vaccines? You must respect people's opinions. Like someone said in the chat, it takes time to reach this decision-making process. So give people time, continue consultation rather than attaching threats and relating them to the risk of losing their jobs. It would potentially yield a greater outcome if they are more aware of the risk and benefits. Let them weigh these risks and benefits themselves and ultimately come up with a decision on their own.
Yeah, thanks. Kenny, that's really interesting. I mean, it certainly chimes, doesn't it, with the suggestion that pressure reduces willingness to take up vaccination. Thank you. Anyone else want to come on that point?
Can I come in again?
Yeah.
Colin, I think it's interesting because I know my brother and sister-in-law moved to America and their children couldn't get into school unless they'd been fully vaccinated. It was simple, mandatory.
Yeah.
They weren't vaccinated, they weren't going. And I know in other parts of the world, mandatory vaccines are the norm and actually they do quite well. But I think Kennedy makes a really interesting point in terms of the way we approach people and how people are approached is so insightful, because I think if you're low income, you know, you're working in a sort of low income, marginally sort of skilled or whatever, and you have a threat over you being able to work or not able to work based on just exactly that, having a vaccine or not, I think is very, very undermining. And I feel as if it comes back to that question is, how do we help people make the decision? And there was some work done a few years ago about decision aids, especially around MMR. And it kind of you went through this decision aid in such a way as it helped you identify what information were you short of or needed to know in order to make that switch to going from not sure, hesitant, to actually making a decision. And I feel as if those kind of things need to be revisited in the light of things like COVID, which are clearly there to protect both the individuals but also the patients they serve. So just really interesting discussion.
Yeah, thank you. I mean, it's back to trust as well, isn't it?
Yeah.
And trust bi-directionally. So managers trusting their staff leads to staff trusting their managers.
Yeah. And the education that they can give the staff, because if the staff, as Sandra was saying, are migrants, one, they've got a language barrier, two, they don't understand the health system, and then the three, they're told that, you know, if they don't have the vaccine, they'll be in trouble. Then you can see how this happens, and you just think, we need to change this somehow. So really interesting.
Okay, great, thank you. We are sort of coming to the end of our time. It's a really good discussion. I'm enjoying this. I hope others are as well. Right, well, that's us up to time. Firstly, just thank you all the presenters. That was great. We had a really good discussion afterwards. And just to say that please do use the hashtag to tweet about the conference. You now have a comfort break, I believe, until 13:25. with a keynote introduction by Raquel Duarte Davidson, Head of Chemicals and Environmental Effects, followed by a plenary on health, a powerful motivation for climate action. So that promises to be quite interesting, and certainly public health in its broadest sense. So thank you all for attending. Thank you again to the speaker.